Hey everyone, this is Nurse Ryan, and today we're going into practice quiz number 5 for your nursing licensing exams. I'll walk you through the answers and rationales for each question. Starting right off with question number 1. You are a nurse working in a long-term care facility. You observe one of your coworkers yelling at a resident during personal care. What should you do first? And for each question, I'll leave a bit of a break where you can pause and think about the answer. So the answer here is A. Ask the staff member to leave the room, and then you complete the resident's care. The resident's safety is the top priority, and one of the best ways to do that in this scenario would be to separate the staff member from the resident. The resident may not be able to report whether they feel safe or not, or may even feel threatened by the coworker, so it is your responsibility to finish the care for the resident to ensure they are comfortable. Then you can report the incident to either the manager or supervisor according to the facility's guidelines, and the staff member will likely be sent home, followed by an investigation. Question number 2. Which client will most likely be placed in a positive pressure room? The answer here is C, an immunocompromised patient. A very short summary would be a positive pressure room pushes the air out of the room, while a negative pressure room keeps the air in. An immunocompromised patient may require a positive pressure room to keep viruses, bacteria, and other contaminants out of the room. Meanwhile, a client with active tuberculosis, for example, would likely be placed in a negative pressure room to reduce the spread of the tuberculosis. MRSA is spread by contact and does not require a pressurized room. Moving on to question number 3. C. diff can survive for up to blank on inanimate surfaces. And the answer here is D, 5 months. According to a study published in 1981, C. diff may survive for up to 5 months on inanimate objects, and can spread by both asymptomatic and symptomatic patients. It is important for nurses to be aware that when a patient with C. diff is transferred out of their room, for example, a specialized deep cleaning must be performed, generally by the housekeeping staff. Question 4. Which of the following drugs requires regular blood work monitoring during treatment? The answer here is A. Clozapine. Clozapine is an antipsychotic medication used for treatment-resistant schizophrenia. As a side effect, clozapine may affect clients' neutrophil production and maturation, requiring regular blood work monitoring. Question 5. You are a nurse working in long-term care, and you observe that one of your clients has been having difficulty swallowing lately. The client is currently on a general regular diet. You refer your client to the dietitian, who further evaluates the client's ability to swallow. The dietitian agrees with your observation. As the nurse, what do you expect the dietitian will recommend? The answer here is B. Replace the client's thin fluids with an alternative of thickened fluids. Thickened fluids reduce the risk of aspiration in clients who have difficulty swallowing. Question number 6. The nurse will be performing a bladder ultrasound to assess the postvoid residual volume for their adult client. The client has just finished voiding. Which of the following PVRs should alarm the nurse? The answer here is D, greater than 100 milliliters. PVRs of 100 mL or greater should be reported to the physician, as they are an indication of urinary retention and may require the nurse's attention, such as an in and out catheterization. Question number 7. Which of the following procedures require the nurse to maintain sterile technique? The answer is C, inserting a Foley catheter. Inserting a Foley catheter requires the nurse to maintain sterile technique to decrease the risk of infection to the client. Changing a catheter leg bag, changing a colostomy bag, and administering a suppository all require clean technique. Now you could argue that while changing a catheter leg bag, you are keeping the end sterile, but definitely while inserting a Foley catheter, you need to maintain sterile technique. And for the last question of this quiz, number 8, appendicitis is characterized by... And the answer is A, right lower abdominal pain, loss of appetite, nausea, and vomiting. The appendix is located in the right lower abdomen. Appendicitis occurs when the appendix is blocked, causing inflammation, right lower abdominal pain, sometimes referred to as McBurney sign, loss of appetite, nausea and vomiting, and more. And that's it for our 5th licensing exam quiz. If this video has helped you out, please consider leaving a like and subscribe. I would really appreciate it. If you have any questions or would like me to review a specific drug or topic, please let me know in the comments, and thanks for watching.